We're going to see into burns and its management. Though it's a simple topic, a small topic, we will be getting one or two questions from that, so that we are just diving into these. Might kindly switch off your kindly mute your mic. What do you mean by burns? A burn is a typical injury. So a burn can be an injury to the skin or the underlying tissue. So clearly understand that a burn can be an injury to the skin or to the underlying tissue. See, under the skin, you have the subcutaneous tissues, and underneath the subcutaneous tissue, you have the muscles. Underneath the muscles, you have the bones. So a bone, an injury which can be caused by a burn may be involved with your skin, your subcutaneous tissues, your muscles, or your bones. Okay, and this burns, it can be caused by heat. It's not only because of the heat, but it can also cold by heat, cold by cold substances, electrical substances, a chemical substance, friction, radiation. All these things causes burns. Clear? Now, the just leave that. Currently understand the basic anatomy of the skin, right? So uh, the main portion of the skin is the epidermis, right? So the epidermis, underneath the epidermis, we have the dermis, we have the hypodermis, and um, underneath to that we have the connective tissues as well as the subcutaneous tissues. So first layer which comes is your epidermis. So on the epidermis, we can say that it is a mild degree burns. When the dermis is involved, when the hypodermis is involved, the degrees of the burn increases. Okay. Yeah. What is the functions of the skin? First one, it regulates the body temperature. So kindly understand this thing. When a burns occur into your body, the physiology of the skin will be altered. The body won't be able to regulate the temperature of the body. Right. Then the next physiology, next function of the burn is that it prevents the loss of essential body fluids and the penetration of the toxins or the substances. So what happens when burns occur? The body won't be able to maintain won't be able to regulate the loss of the body fluids, right? There will be dehydration all over the body. The entire hydration status of the body will be changed. The toxins can be penetrating into your skin. Infection can occur, right? So skin is the primary substance which covers entire body and prevents the entry of any sort of infections as well as the toxins which is coming into your body. So it will be altered. It will protect your body from the harmful radiations like the radiations from the sun as well as any sort of radiations. Then waste, it excretes the waste as in the form of sweat. It helps to give you a mechanical support. Like sensory organ, since it's the largest organ in the body, it's also act as a sensory organ too. Helps in the vitamin D synthesis. See, 7-dehydroxycholecalciferol is converted into calcitriol. That is vitamin D. Okay. 7-dehydroxycholecalciferol is converted into calcitriol. That is the vitamin D synthesis. Okay. So it regulates the body temperature, body maintains the body fluids, prevents the toxins, right? Then protection of the body from the radiations, sweating, mechanical support, sensory organ, and the formation of the vitamin D. So these are the functions of the kidney. So when once the kidneys functions are these are the functions of the skin. So once the functions of the skin is impaired, all these physiological changes will be damaged. Right. Now, what are the sources of the burn injury? For you can get it from the cooking fires, right? Chemical burn injuries, electrical burn injuries. Right? Now, the types: friction burn, right? Chemical burns, thermal burns, cold burns, electrical burns, or a radiation burn. Okay. So you know what is friction? I think you know all these burns, right? Just understand the frictional burns. See, in the frictional burns, if you when you drive a bicycle, when you fall on the ground, so when you get a friction, so that friction will cause a burns, and the skin will be eroded. Right? The chemicals burns by when you're working in an experimental lab, when the concentrated hydrochloric acid falls on your hand, what happens? You may have a burns. Right? Then thermal burns with the temperature. Cold burns, frostbite is an example. Electrical burns. See, when you get electrical shock, you may have a burns. Radiation burns. Again, when you are heat burn is an example for the radiation. Right. So the examples, the friction burn. You can see this is a frictional burn. Chemicals burns. A radiation burn. A thermal burn. Cold burns. Electrical burns. No, classifications of burns. So these were the sources of the burns, how the types of burn. Now we are going to see the classifications of the burn. This is important. Okay, the classification of the burns is important. You may get questions from the burns. The burns, the burns which you are getting, the main areas for the questions which you are coming is from this classification of the burns. Okay, so first is first degree burns. The first degree burns might be a superficial burn. Okay. Then comes a second degree burns. It's a partial thickness burn as well as a full thickness burn. Okay. Then third degree burns, fourth degree burns. See, for your understanding, kindly understand first degree, second degree, third degree, and fourth degree. This second degree have been again divided multiple times. Okay, we shall look into one by one. First, understand that there is first degree burn, second degree burns, and third degree burns. Okay. Now, just understand what is the first degree burn. First degree burn will be only affecting the epidermis. Okay. The second degree burn may go up to your dermis, and the third degree burn can go up to your hypodermis. Okay, and the fourth degree beyond that. Now, first degree superficial burns. See, this is a first degree superficial burn. Clear. Second degree. See, blisters are forming. See, fourth degree burns. Then is a electrical burn. This is an example for an electrical burn. The bones are involved. Now, what are the local responses that happens in the physiological, pathophysiological conditions? Okay, just understand that when the hypodermis as well as the epidermis are, when the dermis as well as the epidermis are affected, there will be a zone of coagulation at the particular center, and there is a zone of statics around that, and there is a zone of hyperemic condition. Okay, so no questions are so far asked in this local area pathophysiology. Just understand that the areas are divided into some zones. That is enough. Now, see here, this is the main, again, this is the main thing. What happens? Kindly understand this. If you're having any doubt, kindly ask. This is the area. Once you study this thing properly, take the screenshot. Once you study this thing properly, you will be able to answer any sort of questions which is coming from your burns. Okay, so understand here. Once you have burns, okay, once you have burns, okay, once you have burns, there will be inflammatory response. Okay, what is an inflammatory response? If your body is having burns, there will be inflammatory response. First thing. Okay, so histamine, those are your inflammatory agents. Histamine will be released, bradykinin will be released, serotonin, prostaglandin. See, I'm not saying that all of the things will be released. Okay, among this, which will be released, it is depending upon the source of burns, the area of burns involved, like that. Okay, then tumor necrotizing factor, TNF, interleukins, So kindly note these are the inflammatory mediators in the body. Okay, these are the main inflammatory mediators in the body. Vasoactive amine, it's a local area. I don't think it's having a major role. But the major role affecting things are all these things: the histamine, the bradykinin, the serotonin, prostaglandin, TNF, interleukins. All these things are your inflammatory mediators. Okay, the mediators of your inflammation. So once the burns happen, all these inflammatory mediators will be released. Fine. So when these inflammatory mediators are released, it will lead to a cellular shock. So the cell will be in the shock, right? So once the cellular shock happens, it leads to a burns shock. Fine. So that's about the inflammatory mediators. Now, when the inflammatory mediators are released, it may release a systemic inflammatory response into your bloodstream. It leads to a systemic inflammatory response. Okay, once these things enter into your body, see, this is produced. These things are produced by your cells, right? Since these things are produced by your cell, the cells will be in a shock. Okay, now when these things are produced by your cells and it enters into the bloodstream, it leads to a systemic inflammatory response. Now, when it is entering into the systemic responses, when it is entering into the systemic areas, it will lead to a condition known as electrolyte imbalances. Right, the sodium, potassium, calcium, magnesium, all those things will be impaired and will lead to an electrolyte imbalance. See how these electrolyte imbalances are happening. It is because of a vascular permeability. Okay, vascular, microvascular pressures will be changed. See, all these things are like what happens is that this is your blood vessel, right? So into the blood vessel, the lining of the blood vessel, the thinning of the blood vessel happen. So the movement of the substances here and there happen into the bloodstream. So which leads to an electrolyte imbalance. So this is what here this is explaining about. So once this happens, once these blood vessels are the permeability of the blood vessels changes, what happens? The fluid may move from in and out the blood vessel, which may leads to increased extracellular fluid. See, we have explained this is a cell, this is a cell, right? The cells are like this, right? Don't you remember? So the fluid which is present inside the cell may come out, okay, which is known as an interstitial fluid space. So this is an extracellular fluid, ECF, extracellular fluid, right? So once the burns occur, the cells will be damaged and the fluid which is present inside the cell will come out of the cell, which is this space is known as ECF, extracellular fluid. So there will be an increase in the extracellular fluid. So once there is an increase in the extracellular fluid, it leads to edema. Right. So once the increase in the extracellular fluid is there, what happens? The ICF will be decreased. The intracellular fluid or the intravascular fluid will be decreased. Okay, intravascular fluid will be decreased, which means the fluid which should be present in the bloodstream will be decreased. Okay. So blood, when the fluid in the blood it decrease, what happens? It decreases the cardiac output, right? Once the cardiac output is decreased, it will leads to hypovolemic shock. Okay, guys, any doubt on this?
No, sir.
Okay. So let me explain it once again. When you have when you have burns, what is this? When you have burns, see the burns will leads to inflammatory mediations from the body. Example, histamine, bradykinin, serotonin, prostaglandins, like that. So this will lead to a cellular shock. And when these things are released, it will lead to a systemic inflammatory responses. So the systemic inflammatory responses will cause a vascular changes. So when these vascular changes happens, there will be electrolyte imbalances. And when these vascular changes will increase the intracellular fluid. So once the intracellular fluid, uh, when intracellular fluid is impaired and the extracellular fluid is increased, it is known as it's a condition known as an edema. Okay. So when there is an increase in the extracellular fluid, there will be decrease in the intravascular volume. Okay. So the intravascular volume decreases, which leads to decreased cardiac output and hypovolemic shock. Right. This is how the pathophysiology of the burns takes place. So once you understand this, it will be very easy for you to answer the questions which is coming. Okay. Kindly note there is an action with the inflammatory mediators. The blood inside the blood inside the blood vessels will be decreased, hence there will be a decrease in the cardiac output also. Okay. Now, what are the changes that occurs in each and every system? Kindly note, in case of respiratory tract, in case of respiration, there will be a decreased airway circulation. Why? Because of the bronchoconstriction. Why a bronchoconstriction occurs? Again, edema is a reason for the bronchoconstriction. Adult respiratory distress syndrome will be there. Now, what happens to the metabolism? The basal metabolic rate will be increased. Okay, the BMR will be increased. What about the cardiovascular system? The myocardial contractibility will be reduced. Decreased cardiac output, right? Then increased capillary permeability because of the circulation. Then peripheral vasoconstriction will be there. Then immunological response. Definitely there will be a decreased immunological response because skin is the primary areas which prevent these things. Okay. Now, the, kindly understand when there is burns there will be airway obstruction, so there might be majority of the conditions which will be always related with your pulmonary edema. So we have said that there will be third spacing fluid shift, right? The fluid which is present in the cells will be shifted to outside of the cells, which causes an extracellular fluids. So increase in these extracellular fluids are causing the pulmonary edema also. Okay. So these are the things which we have explained again. Now, the same condition. Okay, the same thing which is the different thing. Now, what are the lab investigations that you have to check? CBC for what? Any increase in the count, any increase in the what infective condition. So to understand whether the WBC is elevated or not. Next comes your serum electrolytes level. See, there is why there is a potassium level increases. You can see potassium increase. Why? Why there is an increase in the potassium? In case of burns, the main problem is what you have to check is the potassium increase. Why there is a potassium increase? Anybody?
If in case of potassium impaired means the muscle weakness will be there.
No, no. My question is, in case of burns, why there is an increase in the potassium?
Because there is renal dysfunction. So if a
No, no,
urine
no,
pass
no, no,
out
no,
means
no, 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 no. Renal dysfunction is it's on a later stage. When there is burns, there will be elevation in the potassium. Why? Anybody? See, the
Fluid extracellular ಅದನ್ನ ಸರಿ
no, no,
ಇಂಟ್ರಾಸೆಲ್ಯುಲರ್ ಅಲ್ಲಿ ಎಕ್ಸ್ಟ್ರಾ
no. Then what is the problem with the potassium? See, I have said to you already. In the cell, potassium is the higher content, and in the extracellular, sodium is the higher content, right? So when the cell ruptures, when the cell collapse, in case of burns, all the potassium which is present in in the cell will be coming out, thus increasing in the potassium level. Okay, so that is the reason. See, this increase in the potassium is also associated with the uh, blood transfusion. So I have explained this thing when I was taking the cells. What happens when you're taking the blood transfusion, when you're giving the blood transfusion? Initially, you have to check for the potassium level, right? See, if you are giving a blood transfusion to the patient, you have to start you have to start the what blood transfusion within a half an hour of taking the blood outside the blood lab, right? See, what happens otherwise? The cell will be ruptured. When the cell ruptures, the potassium inside the cell will come out, which increases the serum potassium level. Okay. So any destruction to your cell will leads to serum potassium level increases. Okay. So understand that there will be an elevation in the potassium. Okay. Now, when hypokalemia, when diuresis starts, so when we give a diuretics, there will be a chance of hypokalemia. Okay. And the magnesium level will be decreased. The sodium level. See, initially there will be an increased sodium level, but when the body starts to lose the water, there will be decrease in the sodium level also. Okay. So hyperkalemia will be the hyperkalemia as well as hyponatremia. So this is the status which can see in the serum sodium level of the birds. Okay. No, later stage hypernatremia can be occur in as a later stage as we reserve as we reserves the renal function. Okay, then kindly understand in the initial stage there will be potassium increase as well as a sodium decrease and magnesium. Kindly see the magnesium. Magnesium is also decreasing here. Alkaline phosphate. See, there is an elevation in the alkaline phosphate. What happens to the serum albumin? See, albumin is a protein, right? Okay, albumin is a protein, and thus there is a reversion in the albumin globulin ratio. There is a reversal in the albumin globulin ratio. Why? Because of loss of protein in the edema fluid. Okay, since there is edema, you may have a decrease in the protein. Okay, serum glucose. Initially there is an elevation in the serum glucose as a result of the stress response. Okay, bun bun will be increased. What is bun? Blood urea nitrogen. There is an elevation in the bun. Why? Because of decreased renal perfusion. Your kidneys perfusion has decreased. That's why you can see a elevation in the bun. And also, the creatinine will be increased. Why a creatinine is increased? Because of the tissue injury. The tissues are made up of protein. Once the protein is excreted through the kidneys, or when there is a damage in the protein on a larger scale in the body, you can see an increased creatinine level in the body. Okay, and in the urine, what you can see in the urine, see if there is a larger level of proteins destructed in the body, you can see albumin in the urine, right? Hemoglobin, myoglobin, all these things can be seen in the urine, which indicates a deep tissue damage. Clear? So to understand the further things, we have to do the chest examination to assess whether there is an inhalation injury or not. Fibrotic bronchoscopy. Again, in case of inhalation injuries. Lung scans. MIs to understand the ECG to understand the MIs. Now, what is the assessment of the burns? Palma method. Wallace rules of 9. So, we shall see one by one. Palma method. Kindly study these things, dears. These are usually asked questions. Palma method means area of your palm is considered as 1% of your TBSA, 1% of your BSA, body surface area. See, why this is the 1%? So when you cover your hand in each and every area, you will calculate 1 plus 2 plus 3 like that. So that is a Palma method. Next method, whereas rule of 9. See, this is the rule of 9 which we are using nowadays. Okay, even though uh, this is also a outdated method, but since this is available, we are using this. Okay, rule of 9 method. You know this, right? The face is 4.5, the back of the head. So when your entire head is affected, we'll call it as 9%. Anterior chest 9, posterior chest 9. Okay. Abdomen 9, backside of the body 9. Then your anterior hand as well as your posterior hand 4 plus 4.5 plus 4.5. Then your perineal area 1%. Leg anterior portion 9, posterior portion 9. So altogether you will get 100%. I hope this rule of 9 is very well. You know this rule of 9, right? All of you would have studied this rule of nine. So this is the method which we are focusing on, the rule of nine. So kindly study this, kindly take the screenshot. The questions will be based on this rule of nine. Okay, no questions. Other methods won't be asking. Just rule of nine is the method which is asked in your exam. Okay, they'll just see the questions comes like that. They'll give a patient have been brought to your hospital, and the anterior chest is involved. The one leg is involved. Uh, f- what is the percentage of burns affected on the scale of rule of nine? So thus you have to calculate it. Okay. See. Now, first aid for the burns. First, stop the burning. That is the first thing. First aid for the burns. Okay, stop the burnings. See, if you are seeing a patient on the burns, strip hot clothes as well as jewelry. See, I am saying that you should. Again, I am saying that if there is a burns, you should not remove the clothes because there is a high chance of the skin will be attached towards to the cloth, and when you remove the cloth, the skin also will be peeled off. So when the patient is in your hospital, don't try to remove the clothes. But this is the first aid. Once you see, when you see the patient is on the burns, first thing you have to remove the clothes. Why? Because see why? Because it haven't started. The skin haven't started attached towards the your dress, right? So before the skin attaching towards to the skin to the dress, you have to remove it. And next thing, you have to remove the jewelry. Why you have to remove the jewelry? Because there are two reasons. One thing, the jewelry is a metal, so it's a good conductor of a heat. So once the jewelry gets hot, it will radiate the heat, and it again leads to a further secondary burns. That is the one reason. Second reason is that if you worn a watch, or if you worn an bangle around your wrist, there will be edema. So the once the edema starts, you won't be able to remove your jewelries as well as your watch, so that it again causes disruption. Compartment syndrome might be happen though. Okay, then that is an S. T4. Turn on the cool tap. See, first thing, uh, just open the tap. Keep the hand or the affected part under the running water. Okay, then organize, just for the medical area, and protect the burn area, like with then clean clothes or something like that. So that is the first aid. No, the medical management. This is the area which we are concerned about, the medical management. See, the medical management, the phases of the burns are broken down to three phases. Okay, emergency phase, intermediate phase, as well as rehabilitative phase. We shall see one by one. The emergency phase. What is the emergency phase? So the emergency phase begins immediately at the time of injury and ends with restoration of capillary permeability. Okay, so the emergency phase starts soon after the patient is brought to your casualty, and it ends when we restore the capillary permeability. Okay, once we restore the capillary permeability, the emergency phase is over. What is the main goal? The main goal of this phase is to prevent the patient from hypovolemic shock and to preserve the vital organs. Okay, to prevent the patient from hypovolemic shock and to preserve the vital organ. That is a goal in this emergency phase. Now, fluid requirement. We have a lot of fluid calculation method, but the Parkland formula is the mostly used. Kindly study this. Again, questions for your exam. Lot of times the Burns fluid calculation has been asked. So Parkland formula. Kindly study this. Parkland formula for total fluid requirement. This calculation is for 24 hours. Okay, so 4 ml of ringer lactate into TBSA. What is TBSA? Total body surface area affected. So suppose the patient is having a 30 percentage of burns, and the body weight is 70 kg. Then what will be the equation? What is the amount? Anybody? Yes, it will be around 8,400 something milliliters. So 8 liters of fluid, or 8 liters of fluid you have to replace to this patient. Okay, and this in the 8 liters of fluid, the 50 percentage should be given in the first 4 hours, first 8 hours, which means the 4 liters of ringer lactate have to be infused in the first 8 hours, and the remaining 4 liters in the next 16 hours. Okay, this is how we calculate the Parklands formula. Clear? 4 ml 4 ml ringer lactate into TBSA. This is the total body surface area. How we can get this TBSA calculation? This is the calculation how we does in the by doing the rule of nine. Okay, by taking the rule of nine, we'll be able to calculate the TBSA calculation. Clear, guys? Any doubt in Parkland formula?
Clear, no doubt.
Okay, okay. Next, answer this question, please, guys. Fast, answer this question. A patient is brought to the emergency after sustained burns of 27 degrees. So TBSA, the TBSA is 27 percentage. The patient is having 98 kg. What is the total amount of fluid that you have to give in the first 4 hours? Sorry, first 8 hours. The first area, first 8 hours. What is the calculation? Guys, answer please. Princy, what is the answer? Hello, Princy. Hello, Princy.
Hello, sir.
Yeah,
I'm
what's the
doing.
answer? What's the answer?
Don't know, sir. I'm just doing.
Okay. Niveda, got the answer.
Sir, I don't know, sir. Call, sir.
Calculate it. Calculate it.
Yes, sir.
So 5 liter fluid in the first 8 hours. Next to 5 liters, remaining 16 hours.
5.292 ml. Yeah, that is the answer. Fine. Now, second formula. So first one was Parkland's formula, right? So Parkland formula is 4 into TBSA into body weight. That is the simplest equation. Next is the Evans formula. Okay. So in the Evans formula, we are giving the crystalloids. Okay, so the crystalloids, how we are giving this crystalloids. So Evans formula is this calculation is for your first 24 hours, right? So in the Evans formula, we'll give the crystalloids. So 1 ml of crystalloids per kg per TBSA plus the albumin at 1 ml per kg per TBSA. plus 2000 ml of 5% of dextrose. So this is the calculation for the crystalloids, which we are giving in the first 24 hours. Okay, in the second next 24 hours, we'll just cut short the crystalloids as well as the albumin by half. Kindly note here the crystalloids 1 ml of crystalloid, 1 ml of crystalloid per kg per percentage of the body surface area affected. If the patient is having 75 kg, then it will be 75 ml of crystalloids. Okay. 75 ml of crystalloids will be given for this TBSA. Plus, so this is the crystalloid. Now, albumin. Again, 75 ml of albumin. Plus, we'll give 2 liters of D5. This is the Evans formula. And half will be given in the first 8 hours. The remaining in the last 16 hours. Clear. So this is Evans formula. So I don't think you will be getting questions from Evans. The only question usually they ask is from the Parklands formula. So that's why you have to study the Parklands formula very well. But in case if they ask Evans formula, this is the Evans formula. Okay. Clear. It's a crystalloid. Since it's a complicated question, they won't ask it. But you just understand it is the crystalloid, it's the albumin, and it's a 5% of dextrose which they are giving. Kindly note the crystalloids are the albumin is the and 5% of dextrose is the instead of Evans formula. Clear. Next classification is Brooks Army formula. Okay. Brooks Army formula. In this Brooks Army formula, they'll give ringer lactate. So 2 ml per kg. That is the Brooks Army formula. Just study like this. Per class will be the show question. Okay. If they are asking, per class will be the question which they ask. Okay. To calculate the fluid. Now, for the burns, the fluid calculation formulas are first one is Park-Class formula, Evans formula, as well as Brooke-Armis formula. Clear? So that was for the emergency phase. Okay. Now, for the emergency phase, we have replaced with the fluid. Three types of calculations are the Parkland's formula, Evans formula, as well as Brooke-Armis formula. So we have calculated the three. Next is the intermediate phase. So intermediate phase usually starts at 42 hours to 72 hours of following the burns, which means we have set the capillary permeability. We have attained the capillary circulation. Okay. So how we have attained the capillary circulation by by doing all these calculations of the fluid, and we have maintained it. Right. So, in the intermediate phase, during this phase, what we are doing, we have restored the capillary refilling, right? But what we want is that we have to wait till the wound is closed. Okay. So, the intermediate phases after the patient have restored the capillary permeability to the point where the wounds have been closed. See, now we want to know some terms here. During the intermediate phase, the attention is given to removing the Escher. Okay. Removing the Escher is the main thing, and other cellular debris. Okay. Other cellular debris have to be removed here. It is not debris, it is called as a debris. Then debridement process. What is the debridement process? So debridement is a process where you remove the Eschers. Okay. And also, how will you remove the ashes? We'll keep the patient on it in the tub or under the shower, and we'll just give a gentle washing on the burned tissue with mild soap or waters, or you can use some enzymes or some other collagen fibers. What is the what is your intention? The main intention of yours is to remove the debris which is present on the skin. Okay. Once you remove the debris, then only the healing process will take place. Okay. See, this is how we keep the patient in the thing, and we'll remove that hydrotherapy cultures. Okay. See, escherotomy. If there is ashes, we'll remove that ashes. Dressing for the burns. See, we won't use those gauze pieces because it may get attached to the wound. So, wound dressing, absorbent hydrogels are the things which we are using there. Okay. The biological dressing, fish graft can be used. See, if there is a burn, fish graft can be used. Amniotic membrane, we can use the amniotic membrane also. Next, third one is the rehabilitative phase. So in the rehabilitative phase, it starts from the closure of your burns, and you have and when you have attained an optimal level of your functioning of that area. Okay, so when the this rehabilitative phase can continue to a lifetime. Okay, because when the wound is so deep. Okay. So surgical management of this. So kindly note the skin grafting is a surgical management. We have split thickness graft as well as full thickness graft. Okay. Split thickness means the graft. Full thickness means we'll completely take the debris. Sorry, we'll completely take the dermis as well as the epidermis. Whereas in case of split thickness graft, we'll just take the epidermis. Then microsurgeries are done. Free flap procedures are done. Tissue expansion. I'm just focusing the names only because in detail we don't need it. Okay. See, this is how we harvest the skin from the thigh of a donor. Okay. See, tissue expansion. This is how we do it. Tissue expansion. See, keeping something inside the tissue. Okay. Nursing management of the ones. First assessment. What is the assessment? Airway, vitals, neurological status, skin exposure, transportation of the patient, fluid resuscitation. The main thing, fluid resuscitation. So, no questions will be asked on this diagnosis. Okay, so that's why I'm leaving it. Pressure garments and so on. No complications of the burn. What is the main complication? There will be infection, right? Then blood volume will be decreased. Obviously, blood volume will be decreased. Blood temperature, the body temperature decreases. Compartment syndrome. I have explained the compartment syndrome. It's nothing like, see, if this is your hand, okay, this is your fingers. Hmm? If you're having one finger, is extra. Okay. See, if you're having a burns here, right? If you're having a burns, at this area you may have an edema. Okay, so this edema will press the underlying arteries. It may be a radial artery, it may be an ulnar artery. So this edema will compress this artery. Okay, and the circulation to this hand will be impaired. This condition is known as compartment syndrome. Okay. See, the compartment syndrome can be happen not only because of edema. Any pressure in any areas can cause a compartment syndrome. Like if we apply a plaster cast over there, if you are having a fracture here and you're applying a plaster cast, when this plaster cast is so tight, it will lead to a compartment syndrome. So how will you understand that the patient is not in a compartment syndrome? That is why even if we apply a plaster cast throughout the hand also, we'll just leave the fingers, the fingernails. We'll just leave the fingernails. Why? We have to check the capillary refillings in the finger. So what is a normal capillary refilling? The normal capillary refilling should be less than 2 seconds. Capillary refilling should be less than 2 seconds. And also we have to check whether the fingers are feeling numbness or not. Okay, the tip of the finger, we'll check the tip of the finger so that the patient is feeling numbness or not. If the patient is feeling numbness, if there is a delayed in the capillary refilling, we can say that the patient is in a compartment syndrome. Okay, so why compartment syndrome in the patient? Because of the edema, right? Then breathing problems in case of inhalation injuries. Then scarring will be the bone or joint problems. See, when the bone is affected, there will be permanent disabilities in the bones as well as the joint. So you need a long-term rehabilitation for that. The patient may go for shock, which is a hypovolemic shock. If it is a heat condition, heat stroke, the patient gave of the stroke, heat stroke. See, the compartment syndrome because of the edema. When this edema happens, the blood vessels will be compressed. So the prevention, how you have to prevent. These are the new technology. No question will be asked from the new technologies. Let's leave research articles. Let's leave. So we have explained what are the burns, degrees of burns, methods of assessment, and the phases. Right. So this was all about burns. Any doubt in this?